Recently, we have become very aware of the opioid crisis in this country. And certainly we as dentists prescribe a lot of opioids, but is there something that we can do to stop using opioids? Because a recent study has shown that someone can become addicted to opioids within 5 days. So the question comes up, is it necessary for us to use opioids? And what are other alternatives? And I'm going to share with you how I stopped using opioids in my practice several years ago. First of all, many dentists are using IV sedation, and certainly oral sedation can be used to reduce anxiety, relax the patient, and we should consider these especially on longer and more involved procedures. With the advent of the development of Marcaine, this had a marked impact on my practice. For I had used xylocaine 1-50 as my anesthetic for many, many years and did continue doing that for my surgical procedures. But here's what happened when Marcaine came into existence. After the surgery was over, I would re-anesthetize the patient with Marcaine. And Marcaine will last sometimes 6 to 8 hours before the anesthetic wears off. And this is the reason why, in my opinion, we can avoid the opioids. At that time, when surgery was over, I would give the patient one of the long-acting analgesics. In my case, I like to leave, because a leave will last for several hours, and I think one Aleve is supposed to last for 12 hours. So what we would do is we would give the patient an Aleve right before they left the office, and we would always give them something in their stomach, because if you take medication on an empty stomach, not only does it irritate the stomach, but the stomach does not realize anything is there, so it may not absorb the medication. So distending the stomach by putting a volume of some type of food or liquid in there will assure that the medication is absorbed. You can give the patient some ice cream, or they might bring a milkshake with them, and you can give them orange juice, but anything to distend the stomach will be beneficial. So therefore, we recommend that 6 hours later, which is half the time necessary typically for taking a leave, they take a second Aleve. So 6 hours later, when the Marcaine is beginning to wear off, the patient has a double dose, as it were, of a long-acting analgesic in their system. And then 6 hours later, they should take the second Aleve. So the patient should experience no pain for at least 12 hours after the surgery. And the other thing that we did is we used some IV and oral steroids. Now, for instance, if the patient has swelling, then they have soreness and tenderness and pain. So therefore, we can eliminate some of the soreness by using IV solutions with steroids added to it, or we can use an oral steroid like the Medrol dose pack. And in that case, I would have the patient begin the initial dose of the Medrol dose pack the day before the surgery, the night before the surgery, if it was a morning surgery, or take it after breakfast if the surgery was going to be in the afternoon. So therefore, by reducing the swelling, controlling pain until a long time after the surgery, I found it was not necessary to use the opioids. We always call the patient the next day to see how they were getting along. Early on, I would call the patient the night of the surgery, but found that they were somewhat groggy and may not remember the phone call. So waiting until they wake up the next morning, and perhaps having a dental assistant do this, just see how they're feeling. And it's amazing and very reassuring when the patients tell you how well they're getting along. And there's nothing like a personal phone call to the patient to show care and concern. So this is the protocol that I used in practice to avoid the opioids. And like I say, the combination of the Marcaine and Aleve after the surgery, the use of steroids to cut down on the swelling, and the morning phone call the day after the surgery all proved very beneficial. So hopefully you can take these and try these concepts and see how they work for you, and perhaps modify them any way that you see necessary. Enjoy.